Regular listeners of this program will be, or viewers, will be very aware, I hope, of the fact that our pharmaceutical system is fundamentally broken in many ways. The incentives that drive big pharma are not the incentives that serve the public interest. And our next guest has what I think is an outstanding proposal for addressing that in the context of one specific problem, but also perhaps in a broader context as well. Dana Brown is the Deputy Director of the Next System Project, which is an initiative of the Democracy Collaborative, and she joins us now to discuss her recent article in the American Prospect. I want to get the headline right. Of course, we writers don't always write our headlines, but the headline is, "Before Big Pharma Kills Us, Maybe Public Pharma Can Save Us." So first of all, Dana Brown, thanks for coming on the program.
Thank you so much for having me.
And secondly, I look forward to hearing more about the next system, because I'm not really thrilled with the system we have now. And I assume that is a comprehensive look at another system, another way of doing things. But let's start with pharma. So you identified a specific problem that big pharma is perhaps ignoring is too strong a term, perhaps not, but certainly not solving. And that is the problem. Well, why don't you tell us, in terms of antibiotic research, what the concern is?
Sure. Well, in this particular article, I focused on the lack of innovation in antibiotic research and development as one example of the problems with the current pharmaceutical industry. But really, the idea of a public approach to pharmaceuticals is that we need an industry that is both responsive to and directed by public health needs. And the private pharmaceutical industry is not that. While Big Pharma is very successful in terms of bringing in money for CEOs and shareholders, it extracts exorbitant prices, as you know, but it also fails to produce many of the medications we need, as evidenced both in recurrent drug shortages, but also in the lack of innovation in some of these critical areas like antibiotics. So the idea is that public pharmaceuticals, without shareholders to respond to, would be free to focus on public health priorities and could actually work hand in hand with public health departments, as they do in some other countries, to not only assure adequate supply of critical medications, but should assure that there's also the production of low-cost medications so they're most accessible to the most people. So we can talk about antibiotics particularly if you'd like, but I think the problems with the industry are broader, and therefore the solutions we need are also broader.
Well, I agree with you on both counts, and I certainly agree that the problems are broader. We've talked on this program a lot about drug prices being out of control, about different alternatives for addressing those drug price problems, and we will continue to do so. But one of the things, and I've written on this subject myself, patent rights and so on, but one of the reasons why I liked your initial focus on antibiotics, and I do want to talk about the broader issues as well, but it's a very good example of why the current system does, and especially how and why the current system doesn't often work to meet public needs. And by that I mean because antibiotics, for example, as you point out in your article, they are not a highly profitable area for big pharma, whereas chronic disease medications, for example, are, because antibiotics are only prescribed for a short period of time, whereas chronic disease medications are prescribed for much longer periods of time. So that's one reason. But the other is that you start out talking about drug-resistant superbugs that are being, that there's no short-term economic incentive for big pharma, for example, to look into ways of avoiding the rise of drug-resistant superbugs, even though, as you point out, it's a national security risk, among other things, and could really have devastating consequences in the future. There's no money in trying to figure out how to avoid the rise of superbugs or come up with a different class of antibiotics or whatever. So you use that as a starting off point, and I thought it's a very good one. But then you say, well, if big pharma as it currently exists, if the private sector pharmaceutical industry can't really or doesn't have an incentive to address this, maybe we need public pharmaceutical companies. Tell us what those might look like.
Sure. That's a great question. Well, there are several countries that we know of that have public pharmaceutical industries and quite well-developed public pharmaceutical industries, so we can look to some of those examples. For instance, Brazil, Cuba, Sweden, even South Africa is in the process of setting up a public pharmaceutical company at the moment, and their main goal is to manufacture low-cost antiretrovirals for the treatment of HIV and AIDS. But Brazil's public pharmaceutical industry, for instance, they have a network of public labs that do research and development, and they have public manufacturing facilities that produce low-cost drugs. I think they mostly focus on generics, and they work together with the public health ministries to understand what the public health priorities are and then distribute medications. The public pharmaceuticals in Brazil have been very important to a public health strategy called the People's Pharmacies, where they're distributing low-cost and sometimes free drugs, essential medications, to a large swath of the population. And really, the manufacturing capacity of their public pharmaceutical industry has been credited with being essential in stemming the tide of the spread of HIV and AIDS in that country, because they were able to manufacture low-cost generic antiretrovirals and effectively distribute those around the country. In places like Cuba, their public pharmaceutical industry is well known for innovation. They have a quite innovative biotech and biopharmaceutical industry where they produced the world's first cancer vaccine, among a few other breakthroughs. In Sweden, the public pharmaceutical industry even has a retail arm, so people are able to go to a public retail pharmacy to purchase drugs that are lower cost than some of the private alternatives. So there are several different models that we can learn from, and you can imagine a variety of different strategies working in the United States. You could have public pharmaceuticals at a national level, but there's nothing to suggest that you couldn't set up a public pharmaceutical in another jurisdiction, in a municipality or a state. And even begin by manufacturing one single drug where there is a need, where there are recurrent shortages, or where there isn't sufficient competition in the generics market to ensure accessible prices.
Well, I can give you an example right off the top of my head, which is of that particular model, the local model, which is, for example, if you think about if there is, as may or may not take place, a recurrence of the Zika virus problem, you have a situation here in the United States where a lot of the people in this country who are most vulnerable to the Zika virus, and its expectant mothers and their children would be the most likely victims of that. You have areas of Louisiana that are very, very low income, but they also have the climate and so on that's hospitable to the insects that carry Zika. So there's no money for the private sector to go in and manufacture a limited run of a medication, let's say a vaccine, should they prove able to develop one, for Zika in those parts of Louisiana. But a public pharmaceutical company could take that on, both the manufacturer and perhaps aiding in the distribution as well. Is that an example of the kind of thing you might be talking about?
Sure. Well, I think there are a lot of specific examples of local or regional public health priorities which public pharmaceuticals could be tasked to deal with. Right? It might be that in one area of the country, Lyme disease is a large concern. In another area of the country, it might be that they want to be looking into treatments for black lung, right? You can imagine a variety of different applications. But really, one of the things you just brought up is there's no money for certain problems to be attacked. And there's actually a lot of money in pharmaceuticals. One of the questions is the money being efficiently spent? As I'm sure you know, the vast majority of the money for basic research in pharmaceutical development is public money. It's money that comes through grants from the National Institutes of Health and other institutions that we have. But there's a problem that economists refer to as double taxation, as in the public, through their taxes, pay for that initial research to be done, but it's normally done by private pharmaceuticals. Right. Or the fruits of that research is captured by private pharmaceuticals. And then we are, in essence, taxed again when we go to purchase the drugs at the pharmacy. I like to talk about triple taxation, which isn't actually a technical term, but it's the idea that we pay a third time with the private pharmaceutical industry because they've been allowed to offshore so much money. For instance, at the time of the publication of the Panama Papers, Pfizer alone had 157 subsidiaries in offshore tax havens where it held almost $200 billion in profits. Of the top 30 companies with the most money offshore at that time, 10 were major pharmaceutical industries. So one of the ideas of promoting public pharmaceuticals is that it starts to get at some of those larger problems with the industry, or at least provide a viable alternative that is not further contributing to those sort of malicious problems.
Well, I'm really glad you brought up the amount of money that we spend as a nation publicly funding research into pharmaceuticals, because, you know, I was thinking as we were talking, and again, we're talking with Dana Brown of the Next System Project, you know, that in a way, you could use the same description that some people have used for Wall Street, which is the public assumes the risk, the private sector takes the profit. In this case, we assume the risk, if you want to call it risk, the cost of research, basic research that may or may not pan out, and then we allow the private sector to make the profits off that. And so what we're really talking about but you know, tell me if you disagree, when we talk about public pharmaceutical companies, is we're talking about taking it, finishing the supply chain process from research to development and manufacture, that the manufacturer as well as the research becomes public. So it's not as dramatic a change as people might think. It's a change in completing the process, if you will, of doing certain things publicly, because in fact we understand as a nation that there are certain types of research that won't go on unless we do it as a nation, which is why the research takes place publicly funded to begin with. So I guess with that, and you know, again, if you disagree, let me know. Otherwise, I guess I would say, for this country, what are your thoughts on what a public pharmaceutical company might look like? Would it be owned by the government? Would it be owned by, you know, a collective? And how would the ownership structure look, and how would the governance structure look in your mind?
Sure, there are a lot of different possibilities there, and it's one of the areas in which we'd like to do further research to be able to propose some very specific details about what might be the best setup here in the United States. But basically, a public company of any sort is owned by the public through our representational government. So it could be a representational government of a variety of different jurisdictions. As I mentioned, you could imagine a municipal government setting up a public pharmaceutical corporation. What if the city of New York decided it wanted to manufacture low-cost insulin, right? Or the state of California wanted to manufacture low-cost antiretrovirals, right? That's a possibility. And of course, there are different legal concerns in different jurisdictions here in the United States. But the idea would be that a jurisdiction set up a company and then could start contracting with the existing network of labs and research facilities and even manufacturers that we already have, and that, as you say, the public is already pumping money into. I agree with you. The idea really is that of a public option is allowing that public investment in the process, allowing the fruits of that public investment to accrue to the public, right? And a public pharmaceutical company, if it made a profit, could either reinvest that profit in the development of new drugs or even pay a dividend to the jurisdiction which created it. That's happened in Sweden before with the national public pharmaceutical company that it has. So there are many different possibilities. A public pharmaceutical could decide to price certain drugs at cost or below cost if they think there's a public health reason to get that medication out there, right? The way that a public company thinks about profits and loss is different, because part of the public benefit really is in health. It's in keeping people healthy enough to work and participate in public life. So I think the considerations for what is worthwhile in a public company are necessarily different. And that's a really intriguing thing, especially in the health sector.
So from a policy point of view, and I love this idea, and by the way, I love the idea of maybe there are multiple models initially, and you know, we see which one works, and maybe each has its own mission statement of how it plans to address issues like potential profit and so on, because you want to balance the public interest with making a venture self-sustaining and so on. Maybe there's a way to experiment with different models. But I guess from a public policy point of view, or from a public debate point of view, to step back even further, what do you see as the next step in kind of encouraging this conversation to go forward and maybe taking it from the conceptual stage to closer to the actualization stage?
That's a great question. And I think, as you've seen, there's growing support for a public option. I know a poll was done recently, and there was widespread support from Americans living all over the country for some sort of public option in the industry. So I think that's one thing, is to continue to just broadly educate the public about that idea.
And by public option, I'm sorry to interrupt, but public option, just so that our audience doesn't get confused from the affordable healthcare debate where the public option meant insurance, you mean a publicly funded pharmaceutical company?
Yes, exactly. And I use that phrase public option because it already has some purchase, right? Mm-hmm. Because are used to the idea of a public option in health insurance. Why not apply it to another health need that we have, right? The production and distribution of medications essential for the functioning of our society. So I think, on the one hand, there's further education. On the other, there is the further development of this model, right? There's more research that can be done in order to suggest very particular setup for companies at different levels and different jurisdictions here in the United States for how that would function. And then there's a process of liaising with policymakers, with people who are running for office, bouncing the idea off them and iterating, right? Seeing what would work in a particular jurisdiction, what the people care about in that part of the country, and then working on the model so that it really best responds to those needs. That's one of the daunting tasks about doing something in this country. It's so large and so diverse, but it's also really exciting. A lot of experimentation in healthcare has always happened at the state level in the United States. There's no reason why it can't happen on this particular issue at the state level. And we could think of, as you say, slightly different models being developed in various different states. What if we got states competing over who had the best public pharmaceutical company that was really providing for and meeting the needs of those state residents?
Well, I know somebody who's running for governor who might be interested. So, listen, I also love the idea at the national level, too, and I have supported it a lot. I thought your article in the American Prospect was terrific, and I look forward to hopefully having further conversations with you about this idea. So Dana Brown, Deputy Director of the Next System Project. Did I get that right, first of all? Thank you so much for writing it, and thanks for coming on the program.
Thank you so much for the opportunity. I really appreciate it.